Hello, I'm Dr. Brian Haig, one of the Clarian Transplant Center kidney transplant surgeons. I'd like to welcome you to this discussion this afternoon of kidney transplantation. Dealing with renal failure can be difficult, and certainly when one thinks about the options, that can be difficult as well. So I know that you and your families are watching this, and it's not easy to talk about your disease. It's not easy to talk about kidney failure. So what we want to do is deal with a series of questions that I know that you have. When you go into difficult life situations, you have these questions, whether you're buying a new car or buying a new house. And so as we go through this, I'll try to take you through some areas that I believe will hopefully be of comfort to you and make it easier to deal with the entire situation. So this afternoon we'll talk a little bit about indications, we'll talk a little bit about results, we'll talk about how the operation is done, so that at the end of this you'll have a better understanding and more information upon which to base your decision. So having said that, let's go ahead and get started. Well, the first issue we want to deal with then is why kidney transplantation? Some of you may be sitting there wondering, why would I want to pursue kidney transplantation? Some of you maybe have a very comfortable zone on dialysis. You go to the dialysis unit 3 days a week. You stay in the machine 4 hours at a time. You're very happy with that. Some of you may be doing peritoneal dialysis. You're very happy with that. So you might be asking yourselves, now why do I want to do a kidney transplant? It sounds like it's complicated surgery. I know there's some medicine I have to take. Why do I want to shift to transplantation? Well, the answer to that is as follows. The reason that we transplant patients is because of quality of life changes. Now, there are really 3 reasons why we transplant people. Certainly, quality of life is what drives transplantation, but we also believe that people live longer, and we also believe that their health care becomes more inexpensive after a successful kidney transplant. But we think the real reason is quality of life. If you take 100 people who have a kidney transplant and 100 people who are on dialysis, we believe that the people that are successfully transplanted are able to get back into society, get back to their job, interact with their families, interact with their loved ones, and generally speaking, have a better quality of life. Now, the reason for that is as follows. If you think about your kidney function on a scale of 100% to 0%, you need to remember that you have 2 kidneys. And these kidneys normally do not function at 100% of their capacity. Kidneys have a lot of redundancy built into them. So when you develop a disease like diabetes or high blood pressure, like a little Pac-Man, these diseases eat away at your kidneys to the point where you will eventually drop down to about 50% of your function. And this then is where most people develop symptoms of disease. This is when most people would go see the doc. You get to a point in their life where they tell their wife or their husband, you know, honey, I just don't feel well and I really need to go see the doctor. Your feet may start swelling, your eyes may get puffy, you may develop nausea, you may develop vomiting, you may develop headaches, but you come to a point in your life where you realize that something is not the way it should be. So you go see the doctor checks you out, doctor draws blood, doctor calls you back in 2 days and says, hey, I got some bad news for you. You know, this isn't the flu, this is kidney failure. So by the time you get to that point in your life, by the time you get that phone call from your doc, you've already lost 50% of your kidney function. Kidney disease is a very silent disease for many, many months and many, many years. Now, you may get your medication changed, you may get put on medication, you may change your lifestyle, but these forms of kidney failure are a march to the end. And so eventually you're going to drop down here, you get down to 5 to 10% of your kidney function. If you do nothing, you won't survive. Probably die. That's unacceptable to most people. Most people would opt then for dialysis. And we would start dialysis around 5 to 10% of your kidney function. Now, you can be the best dialysis patient in the world. Take all your medicine, do everything your doctor tells you to do, and your reward for that is that you get to live your life at about 10% of your kidney function. So I have dialysis patients come in the office, opt to stay on dialysis. Well, let me just begin by summarizing what we talked about today. And remember, at the beginning of the session, we talked a little bit about why people come to transplantation, what the reasons were for kidney transplantation, and we told you that we transplanted people because we thought we impacted greatly on the quality of their life. The next thing we then covered was patient survival, and we told you that because of the extensive workup that we do, we rarely lose patients. In fact, we know that we only lose 1 or 2% of our patients the first year and no more than 10% at 5 years. So we believe that transplantation is a very safe mode of therapy when contrasted with dialysis. The next thing we talked about was the results of kidney transplantation. We talked a little bit about living donor kidneys, and we talked about deceased kidneys, and we gave you the results of both types of transplantation and showed you what the results would be in the event you had a living donor or in the event that you went on the deceased donor list. Following that, we talked a little bit about the criteria. We talked about what the risk was, a little bit about the workup of transplantation, who we were interested in transplanting, and what patients had problems that might need to be fixed before we could actually get those people on a list and get them transplanted. After the discussion of criteria, remember then we talked a little bit about the operation itself, how the kidney transplant works, technically how the operation is hooked into the arteries and veins of the body, and how the ureter is hooked into the bladder. We then moved to a discussion of complications of transplantation. We talked about a lot of things that went right, and then when we talked about complications, we gave you a list of things that could go wrong after the operation. And then finally, we wrapped up by telling you a little bit about your immune system, a little bit about how your body works in terms of accepting or rejecting the kidney, and the rationale and why you have to take medication the rest of your life. Well, oftentimes, as the case after a discussion like this, it raises questions, and so I'd just like to invite those of you that have questions or issues to give us a call. The staff and I are readily available to deal with questions, and you're welcome to get in touch with us anytime you have any concerns about any issues maybe that stand out in your mind that you'd like to talk about. Thank you. Well, we've taken you through a little bit of the transplant story here. We hope you found this information usable. As I said, the idea is to make this more comfortable for you. Oftentimes, discussions like this tend to generate more questions than they answer. If that's the case, I'm readily available to answer questions, as are any of the transplant staff. So let us know if we can be of any help to you at all. Thank you.